Drugs for treating cardiovascular concerns. At the end of this, students should be able to recognize red flag signs and symptoms that raise suspicions of serious cardiac conditions. Summarize the drug classifications. Summarize the drug classes used to treat cardiovascular conditions, and identify example generic and trade drug names for each drug class. Angina pectis, resulting from myocardial ischemia, from an imbalance between myocardial oxygen supply and demand. If the demand for myocardial blood flow exceeds the capacity of obstructed coronary arteries to supply it, the discomfort lasts until the excessive demand for coronary flow is reduced. Discomfort is more intense and lasts longer when coronary blood flow decrease is marked. Myocardial necrosis may occur, resulting in myocardial infarction, also known as an MI. Otherwise, the episode is one of acute coronary insufficiency, or pre-infarction angina. Anti-ischemic drugs or short-acting nitrates, such as nitroglycerin, are the drugs of choice to reduce cardiac workload in patients with angina pectoris. Nitroglycerin dilates veins, arteries, arterioles, and arterioles, resulting in reduced left ventricular preload and afterload. As a result, myocardial oxygen demand is reduced, decreasing the ischemia. Current recommendation for patients who have previously been prescribed nitroglycerin as is followed. Take 1 dose of 0.4 milligrams of nitroglycerin sublingually when pain starts. If pain does not improve after 5 minutes, the athletic trainer should call 911 before the patient takes any additional nitroglycerin. Nitroglycerin can be repeated every 5 minutes up to 3 doses or until the emergency medical services arrive. Nitroglycerin may be taken prophylactically several minutes before activity that regularly participates angina. Pain is usually relieved in 1 to 2 minutes. Nitroglycerin tablets deteriorate in about 6 months once the original container has been opened. They must be dispensed in the original glass container, never in a plastic vial. Headache and sublingual tingling are common side effects of active, potent tablets. Arteriosclerosis and coronary artery disease. Arteriosclerosis encompasses increased lipid deposits in blood vessels, early plaques, endothelial dysfunction, less vasodilation, increased risk of platelet adhesion, and narrowing of the blood vessels by increasing plaque formation. Taken together, important factors that determine the progress of coronary artery disease are the concentration of lipids in the blood, endothelial function, blood pressure, the activity of the inflammatory system, and the reactivity of the pro- and antithrombic systems. Hyperlipidemia, or dyslipidemia, is an elevation of plasma cholesterol, triglycerides, or both that contribute to the development of arteriosclerosis and diabetes. Arteriosclerosis is initially asymptomatic, often for decades. Symptoms and signs develop when lesions impede blood flow, leading to coronary artery disease and transient ischemic symptoms related to angina pectoris, as well as transient ischemic attacks, TIAs. When unstable plaques rupture and acutely occlude major arteries, a thrombosis or embolism develops, resulting in a myocardial infarction, ischemic stroke, or cerebral vascular accident, CVA, or sudden death without preceding stable or unstable angina pectoris. The treatment for coronary artery disease resulting from arteriosclerosis includes non-pharmacological interventions such as risk factor reduction, lifestyle and dietary modifications, physical activity, and revascularization techniques. Drug therapies to treat coronary artery disease include antiplatelet agents, antitherogenic agents, anti-angina agents, also known as nitrates, angiotensin-converting enzymes, also known as ACE inhibitors, angiotensin II receptor blockers, beta-adrenergic blockers, beta blockers, and anticoagulants. The antiplatelet agents are non-enteric coated, chewable aspirin for acute chest pain. This is typically considered baby aspirin that can be used daily. It reduces short and long-term mortality risks. Anti-atherogenic agents. These are known as statins, such as Lipitor. These inhibit enzymes that block the pathway for cholesterol synthesis. These are effective in lowering the LDL cholesterols. These are widely used in the primary prevention in people at high risks of cardiovascular disease, as well as the secondary prevention for those who already have developed the cardiovascular disease. It is important to understand that many of these drugs have a drug-food interaction, especially with grapefruit. It inhibits the complete breakdown of the statin. Lipitor is associated with muscle pain, soreness, and often weakness. Anti-ischemic drugs. These are typically used with patients who have previous histories of chest pain and hypertension who have been previously prescribed medications. Most patients have a systolic blood pressure of greater than 100 millimeters of mercury, or androgenic blocking agents, prescribed for unstable angina. They can also be anticoagulants, such as heparin or warfarin, also known as Coumadin. Another option is beta blockers. These block the sympathetic heart stimulation. Managing hypertension typically involves a combination of lifestyle changes and drugs. An athletic trainer may encounter these typical first-line drugs for managing hypertension, including diuretics, beta blockers, ACE inhibitors, androgenostin statins, or calcium channel blockers. Diuretics. The athletic trainer should be familiar with common medications used to produce diuretic effects. A diuretic is any substance that promotes diuresis, the increased production of urine. All diuretics increase the extraction of water from the body, although there are several categories of diuretics, each with a different mechanism of action. Loop diuretics. These are a prototype in this class that are used to treat edema. These work by decreasing the reabsorption of sodium in the thick ascending limb of the nephron loop of the kidneys. It has a secondary use to treat high blood pressure and can be administered by mouth or intravenously. When taken by mouth, it is typically beginning to work within an hour. When administered intravenously, it typically begins to work within 5 minutes. Common side effects include lightheadedness when standing, ringing in the ears, and sensitivity to light. Potentially serious side effects include decrease in magnesium, calcium, potassium, and sodium, low blood pressure, and hearing loss. Regular blood tests are recommended for those on this treatment. Loop diuretics are more potent than some other medicines. Thiazides and thiazide-like diuretics. These drugs that act on the distal convoluted tubule of the nephron are most commonly prescribed class of antihypertensive agents in the United States. It is one of the most commonly used diuretics in the treatment of hypertension. Antihypertensive effects can be achieved with oral doses of 25 to 100 milligrams taken once or twice daily. Common side effects include low blood potassium and magnesium, high blood glucose, dizziness, increased calcium in uric acid, and increased serum cholesterol. Beta blockers. Beta receptors are found on the cells of the heart muscles, smooth muscles. Beta receptors are found on the cells of the heart muscles, smooth muscles, airways, arteries, kidneys, and other tissues that are part of the sympathetic nervous system and lead to stress responses, especially when they are stimulated by epinephrine or adrenaline. Beta blockers are competitive antagonists that are predominantly used in managing abnormal arrhythmias and protect the heart from a second acute myocardial infarction after a first one. These medicines are widely used to treat hypertension, although they are no longer the first choice for initial treatment for most patients. Beta blockers reduce heart rate, cardiac contractility, conduction velocity, and relaxation rate, which in turn decreases myocardial oxygen demand and increases exercise tolerance. Heart rate and blood pressure must be carefully monitored during treatment with beta blockers. Dosage is reduced if bradycardia or hypotension develops. Hank Gathers was an outstanding collegiate basketball player who was diagnosed with a cardiac condition after a syncope episode during a game. Secondary to this, he was prescribed the beta blocker, propanol. Hank acknowledged difficulty adapting to the medication because he felt like it slowed him down, so the dose was reduced on 3 different occasions by his physician. During a game, Hank sustained a fatal sudden cardiac arrest. An autopsy indicated he had not taken his prescribed medication for at least 8 hours before his collapse. Providers of critical cases must be certain that athletes understand the consequences of potential deviation from their drug protocols. Hypertension. An ACE inhibitor is a pharmaceutical drug used primarily for the treatment of hypotension. An ACE inhibitor is a pharmaceutical drug used primarily for the treatment of hypertension, chronic kidney disease, and congestive heart failure. These medicines cause relaxation of blood vessels and decreases in blood volume. This leads to lowered blood pressure and decreased oxygen demand from the heart. Because hypertension usually requires lifelong treatment, quality of life issues are an important consideration in comparing antihypertensive drugs. ACE inhibitors require mortality risks in patients with myocardial infarction, especially with those with anterior infarction, heart failure, or tachycardia. The greatest benefit occurs in the highest risk patients. The heart normally beats in a regular, coordinated way because of electrical impulses generated and spread by the myocytes of organized myocardial contractions. Arrhythmias, also known as dysrhythmia, is a conduction disorder that's caused by abnormalities in the generation or conduction of these electrical impulses. An arrhythmia is a rhythm disturbance resulting from cardiac abnormalities of the impulse formation, impulse conduction, or both. Athletic trainers should carefully review each athlete's medical record for history of arrhythmia to ensure proper referral and monitoring. If left untreated, arrhythmias can lead to life-threatening complications such as stroke, heart failure, or sudden cardiac arrest. Some examples of medications used to treat cardiac arrhythmias include sodium channel blockers. These decrease cell excitability, the risk of sudden cardiac arrest in some patients. Calcium channel blockers. These drugs slow the rapid heart rate or the speed at which the signal travels. Potassium channel blockers. These drugs inhibit androgenic stimulation, the alpha and beta blocking properties, and affect sodium, potassium, and calcium channels, prolonging the action potential and refractory period in myocardial tissue, and decreasing atrioventricular contraction and sinus node function. Cardiac glycosides. These medications are frequently used to treat a fast heart rate, atrial fibrillation, atrial flutter, and heart failure. Beta blockers. These decrease heart rate. The adverse effects include lassitude, sleep disturbances, gastrointestinal upset, and sexual dysfunction. And finally, anticoagulants. This is a variety of blood-thinning medications that reduce the risk of blood clots forming and helps to prevent stroke. Thromboembolism. A thromboembolism is the formation of a blood clot inside the vessel. Under normal circumstances, there is a delicate balance between coagulation and fibrinolysis that prevents both thrombosis and hemorrhage. Alterations in this balance in favor of coagulation results in a thrombosis. Thrombi, plural for thrombosis, which are composed of platelet aggregations, thrombin, and trapped red blood cells, can form in arteries or veins. Thromboembolism is the formation of a blood clot inside a blood vessel, obstructing the flow of blood flow through the circulatory system. Even when a blood vessel is not injured, blood clots may form in the body under certain conditions. A clot or a piece of the clot that breaks free and begins to travel around the body is known as an embolus. Two classes of antithrombotic agents exist: anticoagulants and antiplatelet drugs. Anticoagulants slow down clotting, thereby reducing fibrin formation and preventing clots from forming and growing. Antiplatelet agents prevent platelets from clumping and clots from forming and growing. Fibrinolytics, or clot busters, break up the clot once it's formed. All antithrombotic drugs increase the risk of bleeding. The athletic trainer may encounter patients on an anticoagulation or antiplatelet therapy, or a patient may present with a hemorrhagic complication of anticoagulation or antiplatelet medication. Therefore, it is important for the athletic trainer to be familiar with these medications and the risk of bleeding. Antithrombotic medications used to manage venous thromboembolism include anticoagulants or blood thinners, antiplatelet agents, and fibrinolytics, also known as clot busters. This is figure 12.2. Antithrombotic drugs are anticoagulants, also known as blood thinners, antiplatelets, and fibrinolytics, also known as clot busters. In summary, athletic trainers should be familiar with the nature of cardiac medications used by patients and their athletes. Some common cardiac-oriented medications may be cholesterol medications or those to treat hypertension. We must understand the role of medication for treating venous thromboembolism. Athletic trainers must be aware of the application and side effects of cardiac medications prescribed for competing athletes.